Hey team, and this video is about competition climbing and aerial rescue. Now, one of the problems with competition climbing is you don't get to do very much of it. There's not many competitions per year, so you really want to make the best of what you can when they come up. What I will say about competition climbing in particular is that it does improve your climbing ability, for sure. Even being around and doing some of the events definitely can help. Seeing how other people would tackle certain problems would definitely help. But I also know people that are very good climbers and tree workers that would not do very well at a competition scenario in terms of point scoring and stuff like that. So where's the balance? Where's the middle? What have you got to do? Well, with aerial rescue, it's really important to realize that a lot of the points are won and lost at the dummy, at the casualty. So that tells you to get there. Okay, there's no secret. Okay, so getting to the casualty is it. You can break it up into chunks. You can break it up into the introduction, which is you entering the arena and talking about hazards and risks very briefly before setting the anchor and climbing up. So you've got your introduction, okay, which you want to keep brief and to the point, not a whole lot of points there. Then you want to move into setting the anchor, ascending and accessing the casualty, and then you've got casualty assessment, and then securing for descent, and then descending and handing over. So you can break it up into sections to help you. Now, what I'm going to do is I'm going to give you a baseline to work with. I'm not giving away any secrets. I'm not telling you anything that you probably can't work out yourselves if you pay very close attention. But this baseline will hold you in good stead to give you a really good start at getting a whole rescue completed. And once you've got a whole rescue completed with a score sheet, with a score, you can start elaborating on certain things. Okay. So the video is definitely tailored, I guess, for people that haven't done very much. One of my key things is to get more people into competition climbing. I think the more people we get into it, the better the standard will get. And maybe that means one day that potentially the top tree climbing athletes can be that, you know, and maybe earn some sort of living out of it. It'll really help at least fund travels around the world. You know, I think that's great. All sports have to start somewhere. If I think back to rock climbing in particular, when I did a lot of rock climbing and bouldering and things like that, yeah, there was competitions and things, but now there's worldwide known climbing and bouldering competitions, you know, where it's funded, it's sponsored, you know, and there's some athletes, and I think the sport and the activity of tree climbing has got a lot of opportunity to progress into something like that in the future. But we need people to do it, okay? And the important thing is to enjoy it. One of the reasons that I've found people don't really want to participate with them is probably a little bit of nerves. It's probably the biggest one. Like, I've seen some really good climbers and even people that are beginners that would do well, and you know, tried to, you know, kind of talk them into it a little bit, and like, oh, I don't know, I'm a bit nervous about this, I'm a bit nervous about that, and that's fine. So, but to break those nerves, being a little bit prepared will help, for sure. Give you a baseline. I'll show you some things to practice in particular, but it revolves around getting to the dummy. Don't mess around on the floor for too long. Get up to the dummy, get in, do as much first aid as you can on the scenario, read the scenario well, go back to first aid training that you would have done, and go from there. Now, one final thing, in terms of the introduction that I give for this example, it's going to be based around terminologies and things that are used in Australia. So for example, JSA is a job safety analysis. It's like an on-site hazard risk form that you'd fill out, and you talk about where you were, identify hazards and risk, a risk assessment basically. Okay, so just bear that in mind. Other than that, industry speak, it will be pretty much the same. I might use the term like EMT. EMT is for emergency medical technician or something like that. People that are in an ambulance, okay, people that come when you call for the emergency services. But other than that, it should be pretty uniform. So let's set it up and go. Okay, so this is my little aerial rescue tree. Okay, when you get on site, you're starting to think about the hazards and things that you might be able to mention as part of your introduction. Okay, now this is smaller than it would normally be in terms of height and how far you'd have to climb, but like I said, it's a good baseline, give you somewhere to start. Okay, scenario is set. Look, he's not very high up, and to make it a bit more for me, I've set the access line over these limbs here just to make the climbing a little bit more. Climber doesn't have a lanyard. He's just suspended there, and my scenario is that he's cut himself on the left arm with a saw, we'll say a chainsaw. He's then also cut through the lanyard, and the saw has fallen onto the ground and it's buried in the brushwood here. So that's our scenario. We're thinking about all of our hazards for our introduction. We've got some brushwood here from pruning that happened. I say pruning that happened. Bird bath, pedestrians. There is power there, but it's out of the safety distances for this particular tree and this rescue, so maybe I do need to mention it, maybe I don't. Okay, but it's a lot of talking for not many points, so you need to get there. Okay, so the scenario is ready. Let's get this camera on here. There's a little bit of road noise, I apologise for that, but there's not much I can do about it. Okay, so I've got redirect sling, got my device already open, ready to go on the rope. I've got a bridge-to-bridge connection, and that's all I'm going to need. So let's go. Okay, stop work, there's been an accident. Can we find out what's happened? What have you done there, Woody? Oh, you've cut your left arm. Are you able to get yourself down? No, okay, just stay out of this area, please. Make sure that no one comes underneath until we've done an assessment of the tree. Can we please contact the emergency services, tell them we are at the address listed on the JSA, okay, and that we've got a climber who's stuck in a tree, and that I'm going to perform an aerial rescue to get them down, okay? Can you put pressure on that wound, please, there, Woody? I'm just going to set my anchor and come up to you and hopefully be able to get you down, okay? How bad is it bleeding, mate? Okay, that's not so good, is it? So please let the EMTs know that it's bleeding significantly at the moment. He's got his hand on it to stop the bleeding as much as possible. Okay, but I need to get him down as soon as I can. Okay, my anchor is set and load tested. Okay, looking at Woody's system, it looks like it's okay to go. Okay, I'm going to tie a stopper just here so I don't have to look at the very end of the rope. Okay, I'm just attaching myself to the climbing side of the system. Okay, Woody, I'm just going to come up and get you now, mate. How are you feeling? Okay, please let the EMTs know that Woody says he's feeling okay at the moment, although it does seem to be bleeding. He's not kind of panicking just yet, but it might get to that stage. Please relay any information between me and him. Okay, also to the EMTs, and if the EMTs have anything for me, please let me know. Okay, my device is holding. I'm installing and clipping on my ascenders, so I'm ready to go. Okay, on the ground here we can see that there's some brushwood. Okay, there's also a bird bath behind me here. Please keep the EMTs away from this area until I ask you to bring them in. Okay, all right. Okay, well, I'm just coming up now, mate. Okay, so I probably forgot some things there. Okay, getting around here is not as easy as I thought it would be. Yeah, so I probably have forgotten a few things there. Okay, but I'm just gonna come up through. Okay, let the EMTs know I'm just coming past the casualty now. I can't do a full assessment because I'm not close enough. Okay, but I can see that it is bleeding, but his hand is stopping the bleeding a little bit. Okay. Okay, I'm just taking off my chest piece and my ascender. Okay, Woody, just keep still, mate. Keep as much pressure on that wound as you can. I'm now going to hop over above you, set a redirect so I can get a better look at you, mate. Okay, making sure I don't have too much slack here. Okay. Okay, and I'm going to set a redirect. While setting a redirect, I'm just going to put my pole belt on my work position lanyard on, set myself a redirect. Okay. Let the EMTs know that Woody's been in the tree for 5 minutes since the incident happened. Okay, I've got up to him as soon as I can. When I get to him, I will do a primary and secondary survey about his condition. Okay, and update them. My redirect's been installed. Okay, I'm going to drop down through this union now, Woody, so I can get to you. Okay, just going to pull my tail through. Okay, please let the EMTs know that I am next to the casualty now. Okay, I'm going to pole belt myself in where I can. Okay, to keep myself secure. Okay, let them know his airways and breathing are fine because he's able to communicate with me. His circulation is compromised because of the cut to his arm here. Okay, so I can apply a bandage to this arm. I can figuratively do so, or I can actually put one on. Okay, we're going to say in this case that we've applied a bandage, okay, and that we've tucked it away there with a little bit of pressure. Okay, now I'm going to look for any other injuries. Okay, his head and neck seem fine. His shoulders are all aligned. His spine seems in the right position. His legs are all bent the right way, and that his hips are also in line. So I don't believe there are any other issues or injuries. Please relay that to the EMTs and let them know if there's anything else they need to know. Okay, they'd like me. Am I okay to bring him down? Okay, great. What I'm going to do is form a bridge-to-bridge connection, in which I need to be a little bit lower. Fantastic. I formed the bridge-to-bridge connection. I'm taking off my lanyard now. Okay, the system looks fine and active. I'm going to move the casualty away from the tree. Okay, am I all clear to descend? Yes, I am. So down we go. Just going to use my feet to keep the casualty away from the tree a little bit. Okay. Okay, if the EMTs are here, can you please let them into the area now? Okay, not too close until I brought him to the ground completely. I'm just going to keep him off the ground there a little bit, remove my bridge-to-bridge connection, remove myself from the system. Okay, so I can move him into a location where the EMTs can access. Just going to hold him nice and steady. I'm going to bring him towards me out into the open. Put him down on the ground for now. Going to help hold him up a little bit, get slack into the system, and do any further first aid that I can at this point. Sometimes you might bring a first aid kit in to do more. Now he's on the ground. Okay. You can now talk about other things for the handover. Hi EMTs, my name's Ollie. I've performed the aero rescue today. Okay, he's had a cut to the left arm. I couldn't find any other injuries, and I've used one bandage to try and stop the bleeding. Okay, he's been in the tree for about 5 minutes. He's now down here. I'm going to hand over to you so I can carry out instant report forms and report this to the necessary people that need to know. All right. So definitely some things I forgot there. That's the first one I've done in a while, in a long while, actually. But yeah, felt okay. Felt okay. I didn't mind it. That will give you a pretty good base to start with. Okay, things to practice, things you can do at home. Introduction's going to be the same almost every time. Stop the work, find out what's happened, send for help. Doctors A, B, C, D. Okay. Assess any hazards. Just note them. You don't have to go into massive details about them. Okay. That's step one. Step two, practice setting the anchor. It's an anchor that you might have done 100 times, maybe more. Okay. But when you're timed and you're going to get a little bit fumbly, okay, the anchor is going to be the same every time. Often the criteria is that the line is set through low friction. So a basic alpine butterfly, drop the tail through, perfect. You might opt for a base tie, that's up to you. But canopy tie is probably going to score better in most scenarios, I think. Depends. However, setting the anchor, okay? Introduction, setting the anchor, load test. That's going to get you off the ground. If you can get off the ground within a minute, that's really what you want, I think, maybe even before. Depending on the complexity, this climb here didn't have a whole lot to it in terms of distance. Okay, I added some things in, tried to make it a little trickier, and it was getting past that limb up there, wasn't that easy. It's the first one I've done for 6 months, maybe more. But they're just some things that we can practice and get right. Get to that dummy, think about your first day training, cover that, get them down. Transferring them to you using a bridge-to-bridge connection, moving them away from the stem slowly is worth about 4 points, I think, which is a lot, and people lose points there straight away. Okay, so I might dig a score sheet out and have a look at what I think. I used every bit of my time there, every bit of it. I wasn't rushing it. I was commentating over the top of it a little bit, but for a first run, for a while, yeah, lots to do, but pretty good. Yep. Good game, bro. Good game. Well played. Thanks. Yep. Okay, so that's a full rescue done from start to finish. Now, yeah, I definitely missed some things, and I've sat down and looked back at what I did. I've pulled a score sheet out and looked at some conservative scores and some slightly better ones. I reckon I'm anything between 32 and 38, depending on who's judging it. The bare bones are like 29. The absolute bare bones are 29. Which actually, from some of the score sheets I've looked at over the last few years, that's putting you at the lower end, you know, your top 10, middle of that, your top 7, top end of that, your top 5, top 3. So, yes, the baseline, like I said, I wanted to give you a baseline to work with. So you could take from that bits that you needed, elaborate on it a little bit, and yeah, hopefully go better. I've actually found it quite useful recording it for myself, actually, as someone that kind of likes doing these, and I sort of pride myself on the aero rescue a little bit, but I haven't done very well the last few times, like I said, so actually doing it there, recording it, listening back to what I was saying, seeing the things that I missed, like missing the VT on the tree, that was, got nothing for that straight away. Site hazards, I maybe communicated those too late. So that's dropped me down a little bit if I'm being picky, but I think that's true. But yeah, so you're looking at 29 to, like, it depends on the judging, of course it does, but let's say it was, even if it was 30, you know, it's a really good start, a really good basis for you to build on. And if you're going in your first competition and you're getting between 25 and 35, you're going to be doing really, really well. Okay, and you'll feel good because you've completed it, and that's what it's about. And then you'll want to do it again, and that's really important. So hopefully the video helps. Yeah, and I'll hopefully see you at some more competitions.